I remember when I was a very junior consultant, the drug finasteride was the hot topic, and there were studies being done about its clinical use for urinary symptoms, and there were studies on whether it would be good to prevent the onset of prostate cancer. And at the time I remember thinking, this is an amazing drug. You can give it to someone, it's hardly got any side effects, and we know it works because when you measure the PSA, it drops by a half. So you can't say that a drug that doesn't have side effects doesn't have an effect, because we have the biochemical evidence to prove it. But 25 years later, it's not extensively used. So you could say, well, why not? Well, the take-home messages from all those studies was that, one, it does stop your prostate from growing. So a benign prostate, you shouldn't take the finasteride really unless the prostate is large, because otherwise what's the point? And it should be at least 40 cc in volume. And when you take it, it's not necessarily that the prostate shrinks, it's the fact that it stops growing. So if you compare the size of prostates in groups of men who haven't taken it over 5 years and compare it with those who have taken it, there's about a 50% reduction in volume. But note that there's a bit of a statistical twist on that. It's not that the prostates have reduced in size by 50%, it's that they would have been 50% bigger had you not taken the finasteride. So for a big prostate, finasteride can be very helpful if you're prepared to take it for a long time, but it doesn't make your symptoms that much better. It just keeps you at a status quo, maybe a little bit better, but not massively better. And so usually patients who need an operation for a big prostate are leaving a lot of urine behind, or affecting their kidneys, or having very bothersome symptoms, and finasteride doesn't have the impact that you would expect quickly enough to make it a very useful drug, which I think is one of the reasons that most people don't take it on a long-term basis. However, if you're very keen to avoid ever seeing a urologist, it's perhaps not a bad idea if you've got a big prostate. Now, from the cancer point of view, the finasteride works by reducing the impact of testosterone on the prostate cell. So the idea was that if you took finasteride before you got prostate cancer, if you had less testosterone feeding the cells, making them less likely to divide, less likely to get a mutation to get cancers, that you'd get a lower rate of cancer. And sure enough, the studies did show that there was a reduction in the number of cancers identified. But there was also a slightly odd thing in that there were more aggressive cancers identified. So maybe less cancers were identified, but the ones that were picked up were slightly more aggressive. And that put people off using finasteride. Now, I suspect that that was all a bit of a statistical variance, because I suspect people who were taking finasteride, perhaps the cancers that were not viable cancers, the ones which are called clinically insignificant, were just not being picked up on the biopsies because they were smaller, but the ones that were picked up were the more aggressive ones that did need to be picked up because they're the ones that you wanted to treat. So I think finasteride to prevent cancer is still not 100% clear as to whether it's beneficial or not, and I suspect the numbers needed to treat in order to get benefit is going to be a very high number. So that's why, in my opinion, finasteride hasn't taken off like I expected it to 25 years ago. A prostate cancer diagnosis can feel overwhelming, but you don't have to navigate it alone. Our team is here to help you understand your options and support you in choosing the treatment that's right for you. Visit the Focal Therapy Clinic to find out more.